Hello everyone, this is my audience. Hi everyone, my name is Shiran Subar, and today I'm going to inform you on the topic of Hodgkin's lymphoma. Hodgkin's lymphoma is one of the most common cancers in young adults. Did you know that 1 in 6 of every cancers affecting a young adult is Hodgkin's lymphoma? Hodgkin's lymphoma is a cancer of the lymphatic system, which is one of the body's natural defenses against infection. So you might be sitting here wondering, how is this relative to me when you might be healthy, you might be working out every day, and thinking that nothing can go wrong? That's the same exact thought my athletic, healthy, plant-based, 26-year-old sister had when she was diagnosed with Hodgkin's lymphoma. Cancer, including Hodgkin's lymphoma, is one of the most common cancers among 20 to 40-year-olds. However, it can be treated and possibly even prevented. Today, I'm going to talk to you about what Hodgkin's lymphoma is. Then, second, I will talk to you about the signs and symptoms of someone with Hodgkin's lymphoma might have. Lastly, I'm going to talk to you about the treatments and options a patient with Hodgkin's lymphoma can take in order to cure their cancer. To start off with, Hodgkin's lymphoma, formerly known as a Hodgkin's disease, is a cancer of the lymphatic system, which is part of your immune system. The lymphatic system are small vessels that drain the lymph fluid throughout the whole body. Hodgkin's lymphoma affect people of any age. However, it is most common in 20 to 40-year-olds. In 2017, a dictionary of biomedicine mentions that it informs us on what Hodgkin's lymphoma looks like internally. A human lymphoma involving the lymph nodes, spleen, and general lymphoid tissues. A diagnostic feature is the presence of RS cells, giant cells with mirror image nuclei. So what does that mean to us? So it's a cancer that is part of the immune system, which is the lymphatic system, as you can see here. As the cancer progresses, it limits the body's ability to fight off the infection. The cancer makes the cells multiply, where it just basically attacks the body. According to Cancer.net, approximately 2,000 new cases will be diagnosed in people aged 20 to 29 just in this year. Now that you have an idea of what Hodgkin's lymphoma is, I now want to discuss some of the signs and symptoms a person with Hodgkin's lymphoma might have. In 2017, the well-known Mayo Clinic mentions signs and symptoms of Hodgkin's lymphoma may include fever, swelling of the face and neck, a lump in your neck, armpit, or groin, excessive sweating at night, unexpected weight loss, loss of appetite, breathlessness, itchiness, and so on. In my sister's case specifically, she would itch her arms constantly at night. She was fatigued often, and she had excessive sweating at night. So she didn't think much of these things that would lead to something as drastic as cancer. However, what really made it worrisome was when she grew a lump on her neck that would not go away. She thought it would go away. However, after a long time, it continuously stayed there and slowly got bigger. She didn't know this at the time, but that lymph node on her neck was the cancer also spreading to her chest. One day, she was sitting outside at a restaurant. A cat all of a sudden came up to her. As the plant-based animal lover she is, she took some food off her plate and gave it to the cat. The cat snatched the food, scratched her, and ran off. For the next few days, the lymph on her neck grew bigger and bigger. She wondered, did the cat scratching me and the lymph node on my neck growing bigger and bigger have any correlation? She thought it was a crazy thought, but turns out it did. If it wasn't for the cat scratching her, she would have delayed getting her lymph node check, and the cancer would have grown bigger and bigger. It turns out this cat saved her life. Now that I informed you on some of the signs and symptoms, I finally want to discuss with you some of the current treatments and options a patient with Hodgkin's lymphoma can take. Although cancer is a very serious disease, Cancer.org says that the 5-year relative survival rate for all patients diagnosed with Hodgkin's lymphoma is now about 86%. That should give us all hope. There are multiple different options a patient can take in order to treat their cancer. Depending on both the stage they're in, as well as what they feel right for them, there are a few different options for them. It is also very important to discuss and consult a doctor you trust in, as well as if you have loved ones you can speak with. In 2017, according to the Leukemia and Lymphoma Society, the Lymphoma Guide explains a few different options a patient can take. If you are in the earlier stages, there are options they recommend, including chemotherapy and radiation therapy, sometimes depending on how harsh you can take it, sometimes both. Chemotherapy is a drug treatment using chemicals to kill the lymphoma cells, traveling through the bloodstream and reaching almost all parts of the body. Radiation therapy uses high energy beams such as X-rays that kills the cancer cells. There are other options including bone marrow transplant, also known as stem cell transplant, that replaces your old diseased bone marrow with new cells that allows you to grow a new healthy bone marrow. These are just 3 of multiple different options you can take and can consult with your doctor in order to treat and cure your cancer. By learning about Hodgkin's lymphoma, you will have a greater understanding of what one goes through in the process of this illness. But you'll also have a greater understanding that it can be treated as well as even prevented. We should not be fearful. First, I spoke to you about what Hodgkin's lymphoma is. Second, I spoke to you about the different signs and symptoms. Lastly, I spoke to you about the treatments and options a patient with Hodgkin's lymphoma can take. We do not have to be fearful, but by being aware and knowledgeable of what Hodgkin's lymphoma is and what some of the signs and symptoms are, we can save our health, our loved ones' health, and even a life. Thank you so much.
Woo! Very good job.
Thank you.
So good.
Bye.
No cards. No cards.
Some no cards. Thank you.